Okay, welcome back, guys. We're finishing up our content relating to respiratory system. So let's get that done. We didn't have too much left. All right. Where we left off, we were talking about chronic bronchitis. We mentioned how bronchitis is a condition that can be directly linked to COPD. It can exemplify the effects of COPD. So on that note, let's talk a little bit more about that. Regarding COPD, we mentioned how there's a couple things that are associated with it, right? Tobacco smoke or air pollution can lead to this condition becoming more severe. Continual bronchial irritation and inflammation can occur. Breakdown of elastin, which is how elastic the lungs are, leading to these conditions that we talked about in our previous video, bronchitis and emphysema. That can cause airway obstruction, air trapping, dyspnea, which is difficulty breathing, frequent infection, and all of this eventually leads up to respiratory failure, which is flat out when the lungs stop functioning. Lung cancer. Regarding lung cancer, there's not too much we need to get into detail with. The big thing that I talked about here is that it accounts for 1/3 of all cancer deaths in the United States. So it is a rather prominent type of cancer. It is definitely increased incidence due to smoking. So smokers have a higher chance or higher risk of lung cancer, no doubt about that. Smoking anything, really. But in most things that are smoked, like nicotine, for example, in cigarettes, that's going to be considered a carcinogen. It's a compound that can induce cancer. There are 3 common types of lung cancer: squamous cell carcinoma, adenocarcinoma, and small cell carcinoma. I'm not going to get into too much depth regarding that, so don't worry too much about that for our purposes. SIDS, or sudden infant death syndrome. This is a pretty tragic condition. I'm just going to capitalize that for us. This is a pretty tragic condition, no doubt. As the name implies, it's an apparently healthy infant stops breathing and dies during their sleep. One of the biggest problems with this condition is that there's no real way to know what happened. Some cases are thought to be a problem of the neural respiratory control center. So the medulla oblongata and the pons, those are the parts of the brain that help control your breathing. Specifically, the medulla oblongata tells your body to breathe when you're sleeping. So if that part of the brain is malfunctioning, for sure, that can cause SIDS. Another 1/3 of cases tend to be associated to heart rhythm abnormalities. So the heart is beating abnormally, and that can cause issues with how well your oxygen moves through the body. Again, this is not something that is so prominent that happens all the time, but it is still obviously tragic because this typically occurs within the first month or so of birth. This is not something that affects people or affects children years into their life. Asthma. Asthma is a very common condition. Many people have asthma. It's diagnosed or categorized by a chronic, inflamed, hypersensitive bronchial passageways. So chronic in the sense that it's long-lasting. We'll talk about that a little bit more in just a second. Inflammation due to the hypersensitivity of the irritants. What are these irritants in this context? Pollen, perfume, cologne, dust, dander. Anything that can be an irritant is going to cause this inflammation of the bronchioles, which, remember, bronchioles are just the small version of bronchi. What are the responses to this? Dyspnea, which is going to be difficulty breathing, coughing, and wheezing. That's what we typically observe with asthma. Now, how do we treat asthma? Well, asthma is so common that a lot of you probably already know this, and some of you may be asthmatic anyway. The way that we treat asthma is going to be using an inhaler, which is this L-shaped can, and you press down onto it and it releases an aerosol or a gas straight into your lungs. As far as that's concerned, that aerosol is going to have typically most common thing found in inhalers is albuterol, which is a steroid. Steroids, by definition, reduce the inflammation of your body. So if you're reducing the inflammation of the bronchi, or the bronchioles more specifically, that's a good thing. That means that you're able to breathe more effectively. Final thing to mention regarding how the status of how chronic this is. Yes, it is long-lasting. Many people have asthma for years and years and years. Some people have asthma for life. But the weird thing about asthma is that it's a situation that can kind of change depending on your life environment and also how old you are, just your genetics. Some people will have asthma when they're really young, and then when they reach their 30s or 40s, just like that, they don't have asthma anymore. Some people will never have asthma and then later in life develop asthma. So it's strange how that works out. Developmental aspects of the respiratory system. This is honestly stuff I just kind of want to verbally discuss. We don't need to worry too much about it for testing. When we're developing, The lungs are going to be filled with fluid in the fetus. So the fetus, that's typically our form when we're in like the second to third trimester. So when we're developing, the lungs are going to be filled with a lot of fluid. Why are they filled with fluid? Well, think of our surroundings. When you're a fetus, you're surrounded by the womb. You're inside the mother's womb or uterus. So there's no air, there's no oxygen. So it's all fluid, amniotic fluid to be exact. How does the fetus receive oxygen from the mother? When the mother breathes, not only is she getting oxygen herself, but oxygen is also going towards her fetus as well. Lungs are not fully inflated with air until 2 weeks after birth. This is pretty important. It takes a while for that to occur. And then finally, surfactant. Surfactant is a concept or is a compound that we've talked about in some videos in the past, that it's secreted and it covers the alveoli. It helps to lower surface tension. When you lower surface tension, it allows gases to move faster. This does not present itself until late in fetal development, so third trimester, and that can be a problem for premature babies. Being born premature is not necessarily a problem. It depends on how early we're talking about. It's pretty common for babies to be born 2 days early, sometimes weeks early. Months early is when we start to get into dangerous territory. But almost always, if a baby is born prematurely, they're going to be kept in the hospital a little bit longer just to make sure everything looks good, just to make sure that there aren't any major health concerns with the child. Because in this case, if the surfactant hasn't formed yet, the baby can obviously struggle breathing, and they may need to help the baby breathe using ventilators until the surfactant properly forms. Developmental aspects continued. Birth defects that can occur. Cystic fibrosis. This is a rather common condition that can happen. It's scarring of the lungs, and if the lungs get scarred, it can overcreate mucus, which that mucus will then clog the respiratory system. If caught early enough, this can be treated properly. Cleft palate. Remember how we talked about in previous videos how the nose and the mouth are separated by palates. You have a hard palate, which is the maxilla, and then a soft palate, which is muscle, which you can feel if you press your tongue to the roof of your mouth. Sometimes during development, the soft palate doesn't properly form, so a baby will be born with literally a gap found between the lips. So the top lip doesn't form properly, so you'll have a gap. Sometimes it's relatively thin, sometimes it's relatively large. It depends. Because of that gap, you can literally see through and see the tongue, see the teeth, see the gums, see the tongue, and that creates a connection between the nose and mouth. That's a problem. That's a problem because it's going to cause speech problems, it's going to cause eating problems, it's going to cause breathing problems. But the good news is, despite how common this condition can be, globally speaking, it happens pretty often. Despite how common this condition can be, the procedure for this is pretty straightforward, and it's done rather easily. A couple weeks after the baby's born, they're going to graft some of the skin. So they take some of the skin from the baby from another part of their skin, and they attach it to the lip to refuse, to recreate the soft palate, basically. All you're left with is what's called a cleft lip. So you'll have a little scar, and it's going to look a little abnormal compared to like a normal baby's lips, but that's much better than the opposite, right? Where nothing happens. In some countries where there's more poverty and not as much resources, this is more prominent, and some children have to be born with this, and it's tragic. It's tragedy. Granted, the good news is there's medical teams that try their best. I know for a fact, like Doctors Without Borders, they do an amazing job going to countries that are impoverished and trying to do these procedures for free for these people in these communities so that they don't have to live their lives with this. The aging effects of your lungs, this is mostly common sense. The elasticity of the lungs are going to decrease as you get older. Vital capacity is also going to decrease, so you can't breathe as much as you normally could. Blood oxygen levels decrease. You just don't get as much oxygen. Stimulating effects of carbon dioxide decrease. Remember, carbon dioxide is the number one chemical that stimulates your brain that you need to breathe. So that also goes down. And then just overall higher risk of respiratory tract infection. So the long story short regarding your aging and your lungs is the same thing with the rest of the body. You become a little bit more decrepit. Your body's not as strong as it used to be. Your lungs is no different. Now, it's not such a sudden thing that you're a teenager and when you're in your 20s, you're going to wake up with your lungs being totally shot. It's not like that. It's typically something that, especially 40s onward, every 5, 6, 7 years, your body starts to get more and more slowed down. It's a slow burn, very slow process. Finally, to conclude, we have respiratory rate changes throughout life. This is honestly just more informative than anything else. It's fascinating to see the vast differences in our respiratory rates depending on when we live. As a newborn baby, you breathe 40 to 80 respirations per minute. That's insane. If you tried doing that, you would pass out. It would just be too much for your body to handle. Now, why do newborn babies breathe so much per minute? Remember earlier how I said it takes up to 2 weeks for the lungs to fully inflate? That's why. The lungs are like little tiny, tiny balloons, and you can really only put like one breath into it. So, because of that, the babies have to breathe a lot. Not to mention, during that stage of development, you're growing so fast anyway that you're going to need a lot of oxygen. Infancy can be anywhere from like 2 weeks to 2 years. Infancy, you're going to see this number drop to like 30 respirations per minute. By age 5, that number drops a little bit more to 25 respirations per minute, which is still about double the amount that we breathe. You know, adulthood, as far as your lungs are concerned, pretty much high schoolers, teenagers, from teenagers on, that's going to be your breathing rate. That said, life is cyclical after all. At the very end, rate often increases somewhat with old age. So as we get to our elderly years, it is expected that we're going to see a slight increase in your respiratory rate again. So that's something that we do expect to see. Okay? And the numbers wise, it'd be like 18 to 20 respirations per minute. And that's it. The end. I have some videos here. Again, on my Canvas page, I have the links to all the crash course videos. These were incredible videos talking about respiratory system, more specifically discussing the physiology of respiratory system, because in my opinion, that's the more difficult part of respiratory system. So please make sure you go through them. It's a great review, especially before a test. But this was a bit of a lengthier unit, but as long as you've been practicing, as long as you've been keeping up to date, especially with our respiratory content and our physiology content, I think you'll be fine. So guys, thanks for tuning in. Other than that, have a great one. I'll see you in the next series.